Hello, everyone. My name's Ian. I'm a medical student working with Wisconsin Voices for Recovery to bring you the Saturday Night Chat. Saturday Night Chat is a monthly chat that creates a space for people to share their recovery journey and to show people in and seeking recovery that they're not alone and that recovery is possible. Today, we'll be hearing from Desilynn. Desilynn, thank you so much for being here and for talking with me today.
Mhm.
I was hoping to I was wondering if you could tell us a little bit more about yourself and how you got connected to Wisconsin Voices.
Okay, yes, my name is Desilynn Smith. I am a mental health therapist by trade, substance abuse counselor. My biggest title right now is the executive director for United Garden Homes, Inc. It's a community-based organization in Milwaukee, Wisconsin. And here we strive on trying to end the stigma around mental health and substance abuse. How I got connected with Wisconsin Voices for Recovery back on February 11th, um, 2021, my husband passed away from fentanyl poisoning. At that moment, in those days following, I realized my stigma around that I still had, and it was the biggest thing was embarrassment and fear around substance abuse and mental health and acknowledging the need for help. And I was determined to seek out help, and I sought out resources right here in Milwaukee, where I've learned that Milwaukee, Wisconsin has the hardest hit for overdose and fentanyl death
Oh, wow.
poisoning and out of Wisconsin. And then I found out that my zip code was the hardest hit in Milwaukee County. And it just baffled me on why I hadn't heard this before. And
Mm,
it trying to open my eyes. So in my journey of seeking out some support and trying to get resources and trying to get the word out about this alarming rate of deaths, as well as what can I do, I was connected to Wisconsin Voices for Recovery and learned more about Narcan. And they came into the community, installed some boxes, educated me more.
mm.
You never know too much. And that's how I got connected with them.
Thanks for sharing, and I'm really sorry to hear
Hmm.
about what happened.
Hmm.
I was wondering if you could tell me a little bit more about kind of the stigma and you mentioned that you weren't aware at the rate of
Hmm.
overdoses within your zip code or community. I was wondering if you could
Hmm.
touch on that a little bit.
Um, I and I don't know why it wasn't really made public, really, and it just was. I don't know why. If you scout, you know, I went out looking for it. I started learning about it, but no one was talking about it.
Oh,
And when I say the stigma, I used to really pride myself on the fact that, I don't judge anyone, and I'm there for anyone that needs the help.
mm,
But I wasn't really there for myself at the moment, and realized that that stigma, like, you don't want to ask for help. You don't want anyone to think that you can't do your job, or, I'm married to someone, and, how can she work in this field but can't help her husband, or things of that nature, when in reality, the person closest to you usually isn't the one that can really help you in that dynamic. And then my fear of wanting to ask someone to help me,
right,
because it was taking a toll on me as well. So that's where the stigma, and it made me realize even more that when people are looking for that help, I can only imagine how they feel when they're actually in the trenches of it.
right,
So I waited for Mental Health Awareness Month before I actually shared my story, because he was kind of a high profile figure in community work in Milwaukee, Wisconsin. And so a lot of news articles went out about him from the type of work. He made a very huge impact um, for like 2 years prior to his death in community work and community cleanups, as far as violence interruption and things of that nature. So it was a lot of media around his death, especially with it being fentanyl.
right.
And I waited to share my story until May, Mental Health Awareness Month. I just felt that was a good timing, and I just wanted it to be during that time.
Mhm.
And I wanted to be very sensitive around that, and I really wanted to be open and honest about it to let people see that they're not alone.
Mhm. Do you have any advice for people who may be in a similar situation, or people who are seeking recovery, or who are loved ones of?
My biggest advice is really to reach out. Um, I'm I could just say find someone that you feel you can. It's hard to say trust sometimes when you're in those situations, but I like really encourage and really challenge people to just reach out, make that call to someone. Um, one, so you don't feel alone, and two, so you could get some direction on what to do.
Right.
When yeah, so I reached out, um, but what I don't think I was all the way honest with the people, not meaning I kind of candy coated what the situation was. So
Right.
I've learned that when I reach out, that to be all the way
Mm.
honest, to just go ahead, we're gonna have to get in that vulnerable space.
Mhm.
And that's my advice. I really encourage people to do that.
Thank you. Um, I know you mentioned a little bit about mental health, and I guess I was wondering if you could talk a little bit about how you see the connection between mental health and substance use, and maybe mental health treatment being related to substance use, or, you know.
So our mental health is simply the way we think. And if our thinking is being distorted by substance use, then our mental health is affected. I'm really confused how we separate it for me personally because it is in a DSM-5.
Mm, right,
you know.
right,
So the manual that tells us about our mental um health illnesses, that gives the gauge and the categories on how we determine if someone has a mental health issue versus an illness. Substance abuse disorder is in there.
right.
I don't know how we can ever distinguish anything from our mental wellness, because if our mental wellness is not well and not healthy, we're not going to be able to think straight, which is going to interfere with everything we do from our health. We're not going to eat right. We're not going to, do what we need to do. So when it comes to the substance abuse, that is a behavior. That addiction is a behavior, which behavior is formed from our thinking. So
Mhm.
I don't say I really it really irritates me now when we
Mm,
disconnect it.
right.
They're totally connected. So I can't, any good physician, any good psychotherapist, any good psychologist, any good psychiatrist should never even try to diagnose anyone that's under the influence, because they're distorted right then. They should wait to see, there's even a substance induced mental illness. You know what I'm saying? So I
Mhm.
don't know how we can ever disconnect it for me. And I work when with the clients I work with, and when I talk about it in trainings and things like that, they intertwine. They intertwine, and yes, if even if I didn't want to look at the book and think that was factual, it's in the book. It's
Mhm.
in the
Right,
DSM-5. So
right,
it's a mental health diagnosis.
right.
So yeah.
I was wondering, I feel like I've heard before just some stigma around substance use, that it sometimes is
Mhm.
like a character flaw, or more of like a choice. Is that something you've run
Yeah.
into, or?
I run into it a lot, and I get, I pick my battles on who I want to debate that with.
Mm,
And I don't, it's not about my will, my strong will, my ability to stop or anything like that. And I tell them, everything we do, we have a choice. But if things are making our choice foggy,
mm,
if I'm still on a survival mode, and I don't have nothing to make a better choice with. I've never been educated differently. This is all I know. If I don't know any better, I can't do any better. That's why I push education around it as well. I mean, even right now, do you even understand what substance you're taking? Even getting to that root cause. If they don't have, or we don't have any other thing to make a separate choice from, how can I make a different choice? I'm only going to make a choice of what I know.
Yeah.
So even when people say they have a choice, probably, but what other choice do they have?
Yeah.
They
Different.
know nothing else.
Mhm.
Right. Yeah.
What do you think we should do about that? I guess from like, is your organization working through education? Like, do you have advice for people in terms of resources or information to turn to, or how do we address that basically is what I'm trying to say.
That's a good question. I know here in Milwaukee, one of the ways, and I say I can't save the world, but the people I come in contact with. So my biggest thing is that education. And unfortunately, books aren't really written for my community. There's evidence based, and those the structure of it is fine. But how can I teach someone coping skills and they can't read? How
Mm,
can I teach someone coping skills and they've been in and out of prison, or they again don't have a different choice to make? So it kind of gets a little deeper for a lot of the clients that I work with and people I come across. So my biggest thing is education and going back to harm reduction, because for a while it was just quit. In a lot of treatment centers now, everything is cold turkey. No cigarettes, no sodas, no candy, no this, no that. I don't, understand. That's not for me. It's not. Well, I'm not going there. But I think that harm reduction and teaching them those skills and learning how to make a better choice. So for me, it's education, and for me, it's hunting down resources, because I will say there's a lot of resources. I've learned that, but they're not privy to my community.
mm,
They're not privy to the people. They're not. I don't even have privilege to them, and I gotta, make 3 or 4 different phone calls to say, hey, where does this? I might get a pamphlet and it'll have a number, but then when I call, I don't get through.
wow.
And things of that nature. So what am I supposed to do? So
Right.
I go back to the basics and educate the people. I do a lot of things for free, and I take my knowledge and my um non-traditional treatment to the people. I
Mm,
don't wait for them to come to my office
mm,
sometimes. Sometimes I just got to go meet them where they're at for real on the corner and just start talking to them. I don't go out and say, I'm Desilynn, the psychotherapist with this, that degree or this, that license. I just go start talking to them. And amazingly, I found that that's all they need to get that push is someone to listen.
wow. So
Yeah.
you do outreach? Is that through your organization? And
Yes, through my
mm,
organization, that's where I have a team, critical response team is their title.
so
It's 7 of them. And yep, and right now we're out. It's the first really nice day of the season that we've got some information. They're out passing it out into the community, and they're gonna stand around and talk to whoever's hanging out on the corner. Because we do some um we try to interrupt the violence uh um
oh, not sick.
dilemma that we're having going on. You can't prevent it because that's an impulsive decision. So it's like, but interrupting it and getting to those people to interrupt the beginning of it to give them something better. So that's what we do, the outreach. And we let them see who we are. We give them the number, and then we're here for them.
Wow. Wow. Um, so you said a couple times like that books haven't been written for your community. Like, like, you know what I'm saying? The materials are
Right.
accessible to your
So
community. I was wondering.
I give this example all the time. I was working with an 8-year-old African American black male, and he was really upset. And I was supervising the therapist that was working with him. And he says, and we're in there, and because it was her direct client. So I'm allowing her to do everything I did. And I was just sitting there, and he goes, and she was telling him to calm down. And he says, calm down. And he goes, and please don't tell me to breathe. That's not going to do anything. I'm breathing now. So that was a light bulb for me, even though I've heard that a lot of times. I've been to a lot of trainings, and nowhere has anyone calmed down by being told to calm down. And in that moment, no one is going to be thinking about regulating their breathing, right? But to hear this 8-year-old boy say it, the light bulb went off,
Mm,
right? And I already feel, so that's one of the examples I use, because those grounding techniques usually don't work in my community. It's more, the making the eye contact, letting them mimicking your behavior. So as long as you don't get aroused, they don't get aroused, or things like that. That's the best example I think I could come up with when I say a lot of the books aren't written for my community.
mm,
They're different. There are so many different aspects to those things, too
mhm,
many different, and everyone doesn't have the same trauma. I'm not saying that my community has it, but some of the things that have been experienced has not been written in a book for us to know how to deal with it. So it's kind of like we, as these people working with them, have to have some kind of experience in knowing that. So that's what I mean by that.
Okay. Thank you for sharing that.
Mm-hmm.
Makes sense. Um, I was wondering, and sorry if we've already touched on this kind of, but I was
Mm-hmm.
if you're willing to expand a little bit or talk a little bit more about like some myths or misconceptions that either like your community or the public in general or people in recovery have around mental health and substance use. And I just feel like there's a lot
Um,
of information.
there's a lot of them, and what I like, one of the things that I work with people is that myth. Like, we go in and the myth, oh, I don't use cocaine, I just drink. But you are an alcoholic.
Hmm.
Same difference. It doesn't matter. And technically, alcohol is a little is alcohol and opiates are the worst effect on your body because it has more of a physical effect.
Hmm.
So I don't, and I also get I don't shoot up. I I snorted.
Hmm.
What's the difference,
Right.
so that's where I go in, trying to educate them on what addiction really is, and the definition really is just that behavior. To sum it up, it doesn't mean what you're using. So now we'll go into what is your addiction, how is that affecting your life right now. So those myths right there, or I never prostituted myself, so I'm not an addict, I'm not like them.
Hmm.
Yeah, you are. Or I've never been homeless. Doesn't matter. Those are myths that keep a lot of people stuck
Uh,
in a cycle, because I don't even know what addiction is in the first place, but my image of what addiction is, I don't fit that, so I'm not addicted, or I don't have that issue.
that makes a lot of sense.
Hmm.
Yeah, a lot of ideas about what that means
Right,
being
right.
being addicted to a substance. What barriers do people face in general, kind of trying once they've decided they'd like to seek recovery, and what barriers do they face in that
Wait
process?
list, wait list, wait list. For a while, one of our biggest mental health facilities didn't even accept Title 19.
Mm,
So a lot of our community has Title 19. Then there's a wait list. I've from children's wait list on there 6 months to a year for mental health services. So that wait list is extraordinary. Also, the type of treatment you do receive when you get to some facilities, you know. So, but I think that biggest barrier right now is a wait list
Mm.
to get into somewhere. Um, so I don't know. And I see it every day. I see it every day. And I would say that's the number one barrier is the wait list.
And wait list to like all of it. That's
Get in the to
yeah.
get in a treatment facility,
Okay.
whether it be a outpatient, a day treatment where you're, just coming back and forth, or whether it's to get in residential.
Mm. Okay.
There is even for children, there's a wait list to even get an assessment done.
Wow.
But you know what I'm so it's like I'm waiting. So what am I gonna do when I wait? I already was reluctant to even go. I'm
Right.
gonna change my mind,
Right.
you know?
And how does the yeah, that makes a lot of sense. How does the I guess do you pay out of pocket or do you need insurance or how does that function? How is it
So
expensive?
yeah, most places, if they take your insurance, so you got to have certain insurance from some places. I know a lot of places, like the reason that big hospital didn't take Title 19, they didn't get enough money for it. Like it wasn't worth being reimbursed for. So smaller clinics like the clinic that I manage get hit hard because we're just trying to get them, we want to help the people, but we don't, they don't pay for that. So it's like we're definitely not getting rich or anything. It's just that need. So I think the insurance having that right, that either you have the wait list or the particular place you're trying to go to doesn't take your insurance.
Mhm.
Now with the HMOs for the Title 19 HMOs, which is a lot of people call Badger Care, um they used to change your insurance upon request. So say I'm trying to get into this facility and they don't take whatever insurance I have, I can call and the next month I have that insurance. They don't do that anymore. They either have 3 to 6 months to a year before you can switch your insurance.
Uh,
If that agency, I learned because the person that does my billing, if they reach out to that insurance company and say, hey, we need this emergency base, they'll pay for up to 30 days
mm,
for that person to come, 30 sessions, whether it be group or individual or whatnot. So it's a matter of how educated the staff is that does the billing and the rapport they have with the insurance company.
mm,
So that's a barrier. So if my insurance isn't working or isn't accepted here, I got to look around for that. We're not even educated on our insurance. I don't even know half of what my insurance to go or whatever.
right.
I've just been with the same doctor, so I really don't worry about it till I have to go to a specialist, and then I got to wait for prior approval because they call it out of network sometimes, or it's just you just have to get this prior approval. So we're not educated on that piece of it.
Mhm.
So it's just this vicious cycle
Yeah.
because I go get the insurance and I think I got everything. I don't know anything else. It doesn't make them ignorant. It does what ignorant is lack of knowledge, but the term how we use it,
Yeah.
it's just I just don't know. So that becomes a barrier.
Right. Right. Even if people are, like you said, even if people are extremely motivated to
Right.
seek treatment, seek help, there's all these like walls.
Yeah, different. Yeah. And then there's no one that takes the time out. It's just like I called Spectrum. Like I don't work for Spectrum. So you need to educate me on this. The same difference. When a client calls the insurance, they don't work for the insurance company. We have absolutely no clue. Whoever answers that phone should be telling us. So there's another barrier. So it's just those barriers that right at the front door, we get stopped right there.
Right.
So
Right. And then you add on like the stigma. And,
right. So I'm already embarrassed. I'm motivated to come. I already worked up the courage to do this. Now I get this brick wall. So now it's like, let me give up because I don't have any other skills right now in place to keep me motivated.
right.
Yeah.
Makes sense. If you, I guess if or when, because I don't know of your professional goals, but if or when you're mayor of Milwaukee, what would you do? Like, where would the money be going? You know what I'm saying? Where would
Where if I ever became the mayor of Milwaukee, I would definitely seek out those smaller based community organizations that have been doing the work here and have not really been recognized with the right adequate amount of money
Mm,
to have the right adequate amount of staff. We have organizations here that appear to be community-based organizations when they're really national organizations. And then they come because they have a national uh funding source, but that funding source doesn't put money into our community. What happens is that because of that national organization, they're more prone to get a lot of the big contracts,
oh,
and they're more prone to be picked for a lot of the big dollars to go to.
wow.
And then, so to me, that's sucking away from the community-based organizations. And I'm not just speaking about the organization that I oversee. There's a lot of very reputable smaller organizations that I just happen to meet and hear about that are doing extraordinary work in the community, but then everyone's scrambling over a $50,000 grant, where a $500,000 grant or $250,000 grant is going to these nationally based organizations that have a in our community.
Yeah, have a lot of money, I imagine.
Right. They already have money, but they put this here, but they don't even match money back into the community. They sit and get the grants that are for Milwaukee County and then act as if, look, we're doing this. No, you're not. That came from that philanthropy, that, agency that could have been more fit to a smaller organization to help out.
Right.
So that's what, if I was the mayor, I would kind of do that, as well as seek to stop allowing so many outside people to come in and be slumlords and really help in that area, build upon some of the community-based organizations that do have housing for homeless people, or and like seek to how to better their positioning to help people. um Working with some homeless population isn't as easy as people think,
Mm,
because a lot of times they're they're not they can't adapt to living in certain situations. So that takes a little bit more energy and work. People just give them a house. I've worked with people what they call tent city and things like that. And I've really talked to them. I went and there's like, I just can't. But that's a combination. Mental health is not stable. They're not stable. So there's no telling what they feel being inside of a room, let
mm,
alone being inside of a room with another person that they don't know.
right.
So it's not that simple, and it takes more of understanding that. But that's what I would do. Really invest a lot of energy and money to the smaller organizations that are literally out here doing the lead work, that are really community based in Milwaukee, really from the ground up, and really make sure they're supported in every way.
Thank you for that great response. Um, this is a little bit of a kind of going back a little bit, but
Okay.
you talked a little bit about harm reduction and
Hmm.
the importance of it. And yeah, I was just wondering if you had more to share about harm reduction, just because I know that organizations in the past, or there's kind of been almost a stigma around harm reduction,
Yeah.
right? That it like enables or something. That's the narrative.
Right. Yeah, that is what they say. But one of the things I always do is I always um think about things that I tried to stop cold turkey. And I took a lot of different trainings, and from what I've learned is um that's the initial shock on your body to just stop something, no matter what it is. I tell people, I don't care what you put, it's broccoli. Your body, at some point, if you like the broccoli and you stop eating it, at some point, you're going to crave it again. You're going to have a thought about it, or your body is physically going to want that broccoli. It doesn't matter what it is. So when I'm trying to even diet, I have to cut down that, cut back. And so even I don't feel, and I don't get it wrong, I don't feel someone should come into treatment and still use cocaine. That's not what I'm saying.
Uh-huh.
What I'm saying is but when they're getting there, when I'm working with someone to try to get them into treatment, okay, if you spend $50 a day, try spending $30 a day. Let's get this down,
Right.
and where we're going to taper. I used to work at the methadone clinic, and so many people don't like the methadone clinic. And I work with clients that use methadone for 25 years. They were well off. I'm talking had good, but the fear of what they endured with that, and they would have really low dosage, 4 milligrams, 2 milligrams. It's like a drop, right?
Wow.
And as talking to them and telling, let's taper down, go to 1 milligram, you know, and I had them really taper down and see, and it's still a behavior, and it still becomes the vision, and it's trauma, what they endured. So I'm really supportive of the harm reduction. Not like if I'm in treatment, but harm reduction should start in the treatment center prior to getting all the way into treatment. And I think people have a misconception of when they say harm reduction, like it's okay for them to be in this treatment facility and using. That's not it. But it's probably I would say pre-treatment then, if that's how we want to put it in terms. But I don't think anyone, and even the people that fight against harm reduction, can stop cold turkey on anything that they're used to doing. You
Right.
just can't.
Yeah.
You know what I'm saying? It's kind of almost impossible, to just stop. Even people who say, I woke up today and stopped, I can guarantee you prior to that, you slowed down. You didn't just boom, stop using $100 a day worth of something and then got up the next day and didn't use it at all. You eventually you kind of tapered off of it, and then you stopped. You just
Right.
that one day it was done. So that's what I mean by the harm reduction. And it's a lot of people that just don't agree. It's a lot of treatment centers that just don't. They come in, like I said, is soda, no cigarettes, no this, no that. And I'm like, I don't know, and then the first time they do something that's not, they smoke a cigarette, they gotta go, things like that. I do recognize, like the state policy does now, when you're in a treatment center and someone does use, you have to give a really good explanation in that discharge why you discharge them for that first usage.
Oh, really?
And I do want to, there's a lot of people say that relapse is a part of recovery. Relapse is a part of your addiction. If you're working a recovery program, it's a treatment plan. Like if we break it down what recovery is, we get a recovery plan every time we leave the hospital. If we go to the ER, they give us a discharge recovery plan on whatever you went through. They tell you what to do if you pulled a muscle. So when you're in treatment, you get a recovery plan. And as long as you're working that recovery plan, you're not going to relapse. It's when I stop working my recovery plan, when I stop doing my treatment, I mean, not my treatment, when I stop doing what I need to do to stay grounded on my recovery, is when I'm more prone for a relapse. But now I'm drifting back into addiction mode. So, I mean, I know that's kind of old school, and I use this, and I'm a kind of storyteller. My dad was a diabetic, and he was taking 3 shots a day and pills. And they gave him a recovery plan for this diabetic, whatever. And they told him, you exercise, start eating this and start eating that. And he did all of that. And he didn't do no more shots anymore. And he was fine.
Wow.
But what did he start doing? Not following that recovery plan. He started eating wrong. My mom was making cakes, and things like that. So he did not go back into a relapse of the diabetes because he was following the recovery plan. He stopped following it. So that's where he relapsed. And it's when we get outside the box, and that's why we stay stuck in an addiction, we just look at it as drugs. And it's not. It's really not. I'm gonna say one more thing about that. I was at the dollar store looking for some books for my son. He was younger then, and he liked the Harry Potter type books. And I think I'm kind of fat, so I'm looking at the diet books that they have in the dollar store. When I picked it up and I looked at it, it literally talked about a recovery plan. It talked about relapse. It talked about it, and I had to look back at the cover of the book. This was a diet book. So I use that to this day. I made copies of certain pages out of that book, and I pass it out when I do group or
Mm.
even when I'm working with an individual, and they read it and they really think that it's about addiction. And then I show them the book. So if we get outside of thinking, and that's part of the stigma, if people get outside of just recovery is about addiction and drugs and alcohol, and addiction is about drugs and alcohol, I think we'll be a lot better on educating ourselves around that stigma.
Right. Yeah. Wow. Yeah. I've never thought about it like that.
Hmm.
There's so many ideas about what it means, and there's just, yeah.
Right.
Uh,
Right.
I really appreciate like all the stories you're telling. Do you have any thing you'd want, or any stories you would want to or willing to share about clients you've worked with, or like, I don't know, success stories or
And it's funny you asked that, because I was just talking about a young lady today that I just said is 3 clients in my very early career that I worked with that I learned so much from. And there was one young lady that came in, and she was in her early 30s at the time, and she couldn't read, she couldn't tell time or anything. Um, and she had a very troublesome upbringing as far as around sexual abuse, different things like that. So when I'm working with her and I'm kind of thinking, again, the book doesn't talk about when they can't read or can't tell time, but how can I teach her better healthy anything if she can't read and
right,
tell time and she's 30?
right,
So her treatment started off with flashcards from my then 4-year-old son and a digital and analog clock, battery operated clock, to teach her how to tell time and learn how to read. And I'm very proud of her at this point, because she ended up going to technical college. She went through a literacy, and to this day she contacts me
oh my
to
gosh,
tell me that another one is a male, and he, every time he sees me, no matter where we're at, he announces that I was his therapist and I did everything, because he was another one that couldn't read, but he was 40 something. And I'm like, no, you're gonna read this or you're gonna write this, and phonics. So just write it however you think it is. And that gave him the empowerment to then face that addiction better.
mm-hmm.
It's like we come with different sets of problems sometimes,
Mm,
and we don't come from well-off families sometimes. We never learned how to read. We never learned how to cope with anything. And if you need that to survive, let alone how can I start thriving?
right,
So there are several and those people I learned from. I
mm-hmm.
learned from another young man who I learned to never say normal.
Mm,
Like, what's normal, right? And I replace it with healthy and unhealthy,
mm,
because this young man came from a family of like a really high gang type family and stuff, right? So who am I to tell him his grandmother wasn't normal?
right,
That was not gonna happen, right?
right,
So what I did, and I said, is that healthy for you though? Is that even healthy to be able to even survive, let alone thrive? Because we
right,
want to learn how to thrive now,
right,
to blossom, to prosper, not just survive. And he said, you're right, it's not just healthy. So I learned, like, what's normal. Normal is what the majority is doing.
mm-hmm.
So right now, the majority of homicides, the majority of things, that's normal. Majority of what they call dysfunctional families. There's more single parent households
Right,
that society deems as dysfunctional.
right,
And that could be very healthy, whether to have two people in the house arguing, but back to but
Yeah,
so
yeah,
yeah, so those are the stories that I think about that kind of keep me pushed, when I'm feeling burnt out and I need to go talk to who I need to talk to, my support team. And I think about those individuals and how to this day, 20 years later, they still recognize me and they're still doing well.
yeah.
And they attribute some of that to me, and it does make me feel good to know. And unfortunately, the book stuff didn't work for them out the gate. I had to go back to wait, we got to learn how to read
Right.
because you're a grown man and you need some self-confidence. And that, yeah, so yeah.
You wrote a book for them,
Right. Yep.
Wow. Thank you so much for sharing those.
Mm-hmm.
Um, I do want to be mindful of time.
Mm-hmm.
So I don't
Okay.
know where you're at with time. I kind of had one more
Mhm.
question, but
Okay.
are
We
you
could do one more. Yeah, we're fine.
okay? Do I was just wondering, like we talked a lot about stigma and these ideas that people have about addiction and what it
Mhm.
means. And I was wondering what you did, what you've learned, ways like strategies you have to kind of like overcome that, help people overcome that, and connect them to either like therapy or to services for substance use recovery or,
What I've learned was to take my cape off and just be authentic,
Mm,
and not only with others, but with myself. I had to learn that I have to be vulnerable to myself first. I don't necessarily have to be vulnerable to the world, but I have to be vulnerable to myself and authentic. But I do have to be authentic when I work with individuals or talk to other individuals. And I think being authentic gives them some type of empowerment, gives others empowerment. And the biggest thing is I can say is to other people in this position that can help to be that empowerment, that encourage,
mm,
not to tell you what to do,
mm,
not to give you all of this advice, because what worked for me may not work for you, but to give a suggestion to encourage them to talk to someone. And sometimes it's not always the so-called professional therapist that might be the one to help, Um, but as long as encouraging them to talk to someone. And that's what I would say, being authentic and giving them that um support to go and talk to someone. I tell people all the time, you don't have to tell me. You have to tell yourself.
mm.
Because for it to be a day, it has to be a night. So you have to come to grips with what you can't come to grips with in order to find a solution and change it.
Right.
Or yeah, change it basically, which and I tell them it's not the easiest thing in the world. So that's what I would say on that.
Thank you.
Mhm.
Um, Anything else you kind of wanted to mention? I know we're kind of running out of
I
time.
think we said it all. I just think, I mean, I really want jump on the bandwagon to end the stigma to become, and I think once we, like I said, become vulnerable with ourselves, we can then start having more empowerment to encourage others and to talk about it and be okay. We have to be okay with ourselves. We have to learn who we are when we're unhealthy, as well as who we are when we're healthy, because we want to enhance on the healthy part and decrease the unhealthy part. So I think, just sitting down, writing that out for yourself, and we can all begin building on each other.
Thank you so much for
You're
talking
welcome.
to me. And,
Thank you.
or-
Thank you for having me.
yeah, no, it was a pleasure. And thanks for listening. Do
All
have
right.